Hey Archie, this is Yashasvi from Health 2.0 conference. Very, very congratulations for getting recognized on our platform.
Thank you, Yashasvi.
Can you please introduce yourself and your organization you're representing today?
Yes, of course. Hi, everybody. Good morning, good afternoon, good evening, wherever you are joining us in. Today, I am Archie Mayani, Chief Product Officer at GHX, Global Healthcare Exchange. We are a leading healthcare supply chain network, and we were actually founded in 2000. But I would say, we might be the industry's best kept secret because we are truly the engine behind the engine that makes healthcare, quality healthcare, and affordable healthcare happen for all. Over the last 2 decades, we've continued to innovate alongside a passionate community of healthcare providers, suppliers, distributors, other industry stakeholders to really enable, the best healthcare supplies to the best clinicians at the best time. So really, if you think about our deep purpose at GHX, it is to simplify the patient-centered healthcare outcomes for everybody, and make the idea of healthcare and the impact of healthcare affordable for all.
All right, that is really good to know that.
Thank you.
Other than that, like if you talk about this industry, the healthcare industry, how do you think this industry is transforming lives at a global scale?
I mean, healthcare, right? It's like you think about, as you think about sort of industries and what really drives humanity and where is that pervasive impact,
Right,
certainly I think as you think about, technology companies, obviously, they've fundamentally changed, how we live and how we thrive.
right,
But I think healthcare is something sort of from the beginning of time. It's always been about, how do we make humanity live the best life possible? And I think healthcare continues to sort of evolve and revolutionize, how we think about health, well-being, and really sort of, affecting, humanity at a base scale. So
right,
when you think about, this industry and how we are leading the transformation, obviously after the pandemic, it's been a very, very new world
right,
that ushered into. So, I think technology has sort of, really been at the forefront in what you think about sort of the healthcare 2.0, if you will, the digitization or the transformation to really leverage technologies like cloud, like ML, AI, now even sort of Gen AI to
right,
drive that value-based care. And again, this idea of affordable healthcare, which is so fundamental to the US healthcare system, as the costs continue to rise,
right,
we're going to continue to see that evolution of, consolidation of large provider systems. We're going to continue to see new adoption of technologies that I just mentioned earlier. We're
right,
also see, this continuous burnout of our clinicians, and how do we leverage technology to reduce that? So
right,
I think those are some of the digitization themes that we can truly start, looking at, accelerating the
right.
industry well.
I see. All right. That's really good to know that. And other than that, like how did it feels to receive recognition for your accomplishments?
Oh my gosh, Yashasvi, I have to tell you, when I was first told that, I'm going to be recognized at the conference, um, I was thrilled, of course, but I also felt like I stand on, shoulders of so many women who've come before me,
Right,
who made this possible for leadership like me, it's from sort of, and I know I'm going to sound cheesy a little bit, but, even this idea of that I'm here and representing, not just women in leadership, but leadership all around in healthcare. I
right,
think that's amazing to me. And the two women that I especially thought, and maybe it's not just two women, one woman and one girl that I thought about specifically, was for my mom and my
I see.
daughter. My mom, who's who's not doing as well, health wise, and obviously I'm in healthcare, so that gets even more pronounced. Everything that I do, sort of this idea that I'm going to, I may not be able to help my mom, right away, but it is towards that idea that I'm going to make it better for
Right.
millions and millions of people. And then
Definitely.
I think my daughter, who obviously looks, she's 10, she just turned 10. So
Okay.
she looks up to me and she thinks, I'm a superwoman, right? So I definitely feel very, very proud that I was able to share this with both of them, my accomplishment, because I think for one, who's been there all my life to inspire me, and the other one that I can inspire. So, thank you for this recognition.
I see. That's really wonderful to hear that. Other than that, like if we talk about our conference virtually, like you must have attended a conference virtually. So what do you think about it, like our conference?
Oh my gosh, I was impressed with the line of speakers, the topics that were so relevant. And I think this fearlessness to talk about ideas that, that are still sort of, maybe not as well adopted, across the different across different geopolitics, different
Right.
industries. I am definitely more interested in healthcare, since that is my domain, but I was just really impressed with the line of speakers, with the topics that we chose, how relevant and, innovation forcing they were. I think whatever you guys are doing, keep doing it, because I think we need forums to discuss ideas and bring
Right.
like-minded leaders together.
I see. That's really good to know. And yes, we are basically trying to do that, merging people from all around the world into a single place. So that is what we are trying to do, as said there. And that is really wonderful to hear from your mouth as well. Other than that, like what is your leadership style that has made you successful?
Wow. Obviously getting a leadership award, I think that's a relevant question. I would say that, finding your voice that is truly authentic, that certainly helps. But I think if I had to really label my leadership style with sort of one word, because as a leader you have to be, it often rests on sort of the problem you're solving for the people that you're working with, the situation itself, but
Right.
it has to be servant leader. I truly believe that your job as a leader, not as a manager, because those two are different. Your job as a leader is to make sure that you're taking away the barriers from your people so that they can do their best work. I'm just there to serve them. So I think that has been sort of this cornerstone of, being kind and being firm and making sure that, I continue to take away the problems, the challenges that are ailing my team.
Right.
That is something that that has been sort of my at the beginning of my journey, and I hope that I leave a legacy with it.
I see, definitely. That's really good to know that. Other than that, please, Archie, tell us where we can find more about you or where we can reach about your organization to know more about
Well, I don't think I'm a social media butterfly, but you can definitely find me and some of my work and thought leadership on LinkedIn,
it.
um, with Archie Mayani. That is my handle. And then, I would love to sort of, I think there are so many amazing things that we do as a healthcare supply chain network, and I think that is sort of, we're like the best kept secret in the industry. So definitely look at us. We are at ghx.com. We have been founded some 23 years ago as a consortium within the industry. So this is really sort of power of, when people come together, what amazing innovations you can build.
Right.
Yeah, check us out at ghx.com. We are also on LinkedIn. But yeah, looking forward to hearing from any of your audience that is listening to this interview. And if you have any questions, definitely reach out on LinkedIn.
All right, that's fantastic. Thank you so much, Archie, for having me here. It was lovely speaking with you. And yes, like I'll be more than happy to see you in our upcoming conference as well.
Thank you so much for having me here, Yashasvi. It was a pleasure.
Have a lovely day. Bye bye.
You too. Bye.